Ladies and gentlemen, it is with great honor and privilege that we welcome our special guest of honor for this occasion, Pharm.Dr. Joycelyn Azeez, who is representing the Honorable Minister for Health. Madam, kindly give me a few minutes to read a brief citation about you. Thank you. Thank you very much. Pharm.Dr. Joycelyn Azeez is a pharmacist who has worked with the Ghana Ministry of Health. She is still working with the Ghana Ministry of Health in various capacities at the district, regional, and national levels for over 28 years. She is a fellow of the Ghana College of Pharmacists and a member of the governing board of the Pharmaceutical Society of Ghana. She holds an MBA in finance and is a certified global supply chain manager. She is currently the Director of Pharmacy of the Ghana Ministry of Health and has done extensive work in pharmaceutical health system strengthening, as well as supply chain reforms in the Ghana health sector. She has mentored and trained many pharmacists, including myself, thank you, madam, and supply chain personnel who have worked under her as interns and in other capacities. The implementation of the Ghana Antimicrobial Resistance AMR National Action Plan is currently coordinated by her directorate at the Ghana Ministry of Health Head Office in collaboration with all key stakeholders through a multidisciplinary antimicrobial resistance platform in accordance with the One Health approach. Dr. Joycelyn Azeez is a national facilitator for capacity building trainings for various cadres of staff aimed at improving their knowledge in best practices in the pharmaceutical sector. She offers technical support to various programs in the Ghana health sector, such as the National Malaria HIV/AIDS, and tuberculosis programs. She has also served on many technical working groups in the health sector to produce key policy documents as well as the provision of technical support in the development of program strategic plans, operational plans, and development of oversight systems for monitoring and evaluation. Please join me with a thunderous round of applause in welcoming Pharm.Dr. Mrs. Joycelyn Azeez to the podium for her speech.
Thank you very much. When your classmate has delivered so well, you are motivated to do the same. Kofi, in fact, I want to add a Francis Kofi Abuajinyami, thank you very much for doing a good job. Nana Chair, please permit me to stand on all existing protocols. Before I go on to the speech, I just want to say that I'm doing this on behalf of the Honorable Minister, Honorable Bernard Okoe Boye. I just realized that he bears the same name with Nana Chair. Yes. Our thematic speaker has actually set me thinking. Like it was rightly said, I've worked all my life in the Ministry of Health. And even as he went through all the things, I kept on asking, what more can we do? And I throw the same thing to you. He's raised a lot of pertinent issues. I know that the chairman will try to summarize all that he said. But I think that together here, we can make a difference. He's raised issues of governance. He's raised issues of stewardship, which I think is key. Just last week, we were at a funeral, and the first rector of the college called me aside, and he said, Joycelyn, I have a thought. Don't you think that we can come? I don't know whether he's here. Pharm.Dr. Philippanum. He's not here, but he called me aside. Raymond was there. He said, can't you think about something that would help to shape the administration of pharmacy? And I'm talking governance. So I'm not really surprised that Kofi has mentioned it. What this brings to the fore, ladies and gentlemen, is the fact that there are issues that we haven't paid attention to. And I hold myself responsible for this in a certain way. I want to beg of Rector that after this, let's find time to brainstorm to see how we can address these issues. Because no matter how hard we work in our corners, if we don't come together to address these issues, our impact will not be felt. He mentioned impact. You've all gone through rigorous processes to be specialists. If your impact is not felt, then you might as well not do anything. So on this note, I'm going to stop talking plenty and do the job that I've been asked to do. Honorable Okoe Boye would have really loved to be here, but as you all know, issues happen and he had to go. So I'm delivering this speech on his behalf. And he says, I'm very happy to be able to join you for your annual general meeting and scientific conference this year. Your theme for this year, specialist pharmacy service delivery for the attainment of universal health coverage towards the SDGs, really reflects your awareness of the need to accelerate action towards attaining universal health coverage and the Sustainable Development Goals. It also shows your commitment to play your part in that direction, and this is very much appreciated by the Ministry of Health. The Ghana College of Pharmacists has, since its establishment, contributed significantly towards the attainment of universal health coverage through training of specialist pharmacists in all areas of practice. Specialist pharmacists in pharmaceutical care are leading teams and contributing to the management of patients and clients with various disease conditions. Those in public health and social and administrative pharmacy are leading and supporting the development and implementation of policies and programs to secure the health of our nation, be it COVID-19 or antimicrobial resistance. Specialist pharmacists in drug production and quality assurance are developing medicinal products and vaccines to assure the availability of medicines and vaccines through normal times and times when supply chains are disrupted. My understanding is that as demand for specialists change, the college designs new programs and retunes old ones to ensure that the needs of the country are always met. It is also uplifting to note that starting this year, the college is admitting fellows by coursework, and I think we've all attested to that. Nana Chair, I think congratulations are in order for this initiative. I am aware that the college is not only training specialist pharmacists who become members and fellows of the college. There are also short courses and CPDs, and by that I mean continuous professional development courses, that have been designed to equip pharmacists with various specialist competencies as they contribute to the health of the nation. I will mention two that I find really interesting, particularly within the context of this year's theme. The first is the Pharmacist Vaccinator Program, which has equipped pharmacists with the knowledge and skills to be able to participate more actively in immunization activities. And I pause here to say a big thank you to Dr. Mrs. Martha Jansalutrot for the important role that she played in this very activity. And of course, that of Rector. It wasn't an easy thing, but thank God we were able to do it. Knowing the gaps in vaccination that still exist within our nation, I commend this program as being very well placed to ensure that we leave no one behind when it comes to immunization. I understand that this was developed in collaboration with PATH, and for this, the ministry is grateful. The other program of great interest is the one on handling of oncology medications, and I'm happy that we have pharmacists who have specialized in handling oncology medications. The minister is very excited about this. And he notes that he's further informed that pharmacists from the whole continent are actually expressing interest in this program, which has been developed with support from World Child Cancer and is being rolled out from Kolebu Teaching Hospital, the Tamale Teaching Hospital, and the Greater Accra Regional Hospital. I think another round of applause for our World Child Cancer program manager. She's done so well. I recall her passion when she walked to my office. It was like, Madam, I need help. Blah, 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 blah. She went on and on. I said, relax, we'll get there. Thank you very much, Madam. Yes. Also, the Ghana Health Service and CHAC have identified pharmacists who need these skills and getting them trained to support the management of our patients. So you realize that there are lots going on. And we are indeed grateful to Nana Chair, the college, the council members, and indeed everyone that is associated with the college. They are doing a lot. Nana Chair, I highlight these two short courses because Not only do they lead to the delivery of specialist pharmacy services, but it also shows how collaboration among like-minded institutions go a long way to get us closer to attaining the Sustainable Development Goals. Indeed, collaboration is identified as one of the goals. Nana Chair, ladies and gentlemen, I am aware that the College of Pharmacists is facing some challenges. And to be sure that Rector would be satisfied to know that the ministry is aware of her problems, I noted them. Honestly, knowing the struggles that she and I and others went through with accommodation, I thought she would have mentioned that first, but I think she reserved that for the last. And when indeed someone started clapping when she said the place had been identified for development, I said to myself, this is a clap of faith. Because it is a big problem. College has problems with accommodation. Minister says when he settles well, he would make sure that we see to the resolution of this problem. We are aware of the issues of financial clearance. Again, we want to assure you that once we get the financial clearance, college will be covered. She went on to talk about other issues. Nana Chair, ladies and gentlemen, I want to assure you of Minister's full support to ensure that the college is run well. Thank you. Indeed, the Honorable Minister acknowledges the need to support the college to acquire premises that are commensurate with work being done there, and the level of recognition that the college consistently acquiring across the continent. To that end, the Minister says his doors are always open to discuss how we can support the college to achieve its mandate. Nana Chair, I will now turn my attention to the newly inducted fellows and members. I have a short poem, my favorite quote, and I'm going to say it for you on your special day. The height by which great men reached and kept was not attained by a sudden flight, but they, whilst their companions slept, were toiling upwards in the night. You have indeed toiled. And so today, we all join in saying, Ahiko to you. But the minister has some words for you. He says, new inductees, you have just been admitted as fellows and members of the Ghana College of Pharmacists. This is a recognition of the pharmacists. By this induction, we are telling the whole world that you are competent to work as consultants, specialists, and senior specialist pharmacists. With this recognition comes responsibility. With this recognition comes what? May it never be said that you were a specialist and you did not impact. Amen. You must demonstrate your knowledge and skills to provide specialist pharmacy services. Wherever you find yourselves, remember you are an ambassador of the college. Be sure to be abreast with all developments and also endeavor to train other pharmacists to move us closer to the attainment of the SDGs. This is very passionate to me. We recently inducted newly qualified pharmacists. My interaction with them made me a bit sad because I realized that they didn't have direction towards career progression. So personally, I have said to myself that when I retire, I'm going to take it up for myself. I'm going to create a platform where we can mentor these young pharmacists. I want to extend a hand to you specialists to join me so that we create a platform where we can mentor them. Sometimes people just need someone to inspire them. You attain such great heights. I think you should not fold your arms. Let us try to mentor and encourage others. Finally, Nana Chair, as you deliberate on getting us closer to the SDGs through the delivery of specialist pharmacy services, do accept my congratulations on the achievements made by the college in the light of the daunting challenges you face. Also, be assured of the continuous support of the ministry in the execution of your mandates. Congratulations and all the best. Thank you.